Have you ever looked at your feet and noticed a small cut that you couldn't remember getting? Or maybe you've been feeling more tired than usual, waking up several times a night to use the bathroom, or wondering why your vision seems a little blurry some days and perfectly fine on others. It's easy to blame these changes on getting older. Most people do. But if you have diabetes, your body may be trying to tell you something much more important. The surprising part is that diabetes complications rarely appear overnight. In many cases, they develop quietly, sending small warning signs weeks, months, or even years before a serious problem occurs. The challenge is that these signals often seem so ordinary that they're brushed aside as part of everyday life. Many people don't realize that a tiny symptom today can sometimes prevent a much bigger health problem tomorrow if it's recognized early enough. That's why paying attention to these subtle changes isn't about living in fear. It's about giving yourself the best chance to stay healthy, active, and independent for years to come. Think about someone you know who has diabetes. Maybe it's a spouse, a sibling, a neighbor, or even you. Chances are you've heard stories of people who suddenly developed serious foot problems, vision loss, kidney disease, or heart complications. What often gets left out of those stories is that the body usually gave quiet clues long before those complications became obvious. Here's where many people make a mistake. They wait until something hurts badly enough to call the doctor. But diabetes doesn't always work that way. Some of its most important warning signs are nearly painless. They quietly become part of your routine until one day they're impossible to ignore. The good news is that recognizing these signals early can make a real difference. Many diabetes-related complications can be slowed, managed, or even prevented with timely medical care and healthy daily habits. Awareness isn't about expecting the worst, it's about giving yourself more options. Today, we're going to talk about 7 warning signs that every person living with diabetes should know. Some of them are surprisingly common. Others are so subtle that even people who've had diabetes for years may overlook them. As we go through each one, think about your own daily routine. Has your body been trying to tell you something you've been dismissing? By the end of this conversation, you'll have a clearer understanding of which changes deserve a closer look and why listening to your body today could help protect your health tomorrow. One of the biggest misconceptions about diabetes is that if your blood sugar isn't extremely high or if you don't feel sick, everything must be fine. But diabetes is often much quieter than that. It can affect your body little by little, and many of the earliest warning signs are easy to overlook because they don't interrupt your day in a dramatic way. That's why so many people are surprised when a routine doctor's visit uncovers a complication they never saw coming. Looking back, they often realize the clues had been there for months. They just didn't seem important at the time. The first warning sign is slow healing cuts, scrapes, or bruises. Imagine you're working in your backyard garden on a Saturday morning. You accidentally scrape your hand on a flower pot or nick your finger while trimming a bush. Normally, you'd expect it to heal within a week or two, but this time, it lingers. The skin stays red. The scab doesn't seem to improve. Days turn into weeks, and the wound still isn't completely healed. Many people assume this is simply because they're getting older. While aging can slow healing somewhat, diabetes can make the process even more challenging. Here's why. Your blood carries oxygen and nutrients that help repair damaged tissue. When blood sugar remains higher than your target range over time, it can damage small blood vessels, making it harder for those nutrients to reach injured areas. At the same time, diabetes can affect the immune system, making it more difficult for your body to fight infection. The result is that even a minor cut can take much longer to heal than expected. This becomes especially important when the injury is on your feet. Think about how often your feet come into contact with rough sidewalks, tight shoes, small pebbles, or objects around the house. If you also have diabetic nerve damage, known as neuropathy, you may not even feel a blister or a tiny cut when it happens. What starts as a minor injury can slowly become infected if it isn't noticed and treated early. That's why healthcare providers often encourage people with diabetes to check their feet every single day. It sounds simple, but it's one of the most effective habits you can develop. Take just a minute before putting on your socks or after your evening shower. Look for cuts, cracks, blisters, redness, swelling, calluses, or areas that seem warmer than the surrounding skin. If you can't easily see the bottom of your feet, use a hand mirror or ask a trusted family member to help. Many people think, if it doesn't hurt, it can't be serious. With diabetes, that's not always true. In fact, the absence of pain can sometimes make a problem more dangerous because you don't realize it's there. Another common mistake is trying to treat every wound at home for too long. Basic first aid is appropriate for small cuts, but if a wound isn't improving after several days, appears infected, develops drainage, or becomes increasingly red or swollen, it's important to contact your healthcare provider promptly. Early treatment often prevents much larger problems later. The second warning sign is numbness, tingling, or burning sensations in your hands or feet. At first, these sensations can be so mild that they're easy to dismiss. You might notice a slight tingling while watching television in the evening. Maybe your toes feel unusually numb after walking through the grocery store. Some people describe it as tiny pins and needles. Others say it feels like they're wearing thick socks, even when they're barefoot. Some experience a burning sensation that's worse at night, making it difficult to sleep. Many people assume poor circulation is the only cause. The surprising part is that these symptoms are often related to the nerves themselves. High blood sugar over many years can gradually damage the nerves throughout the body, particularly those in the feet and lower legs. Because the damage develops slowly, you may not notice how much sensation you've lost until something unexpected happens. Imagine stepping on a small tack, a sharp pebble, or even walking around in a shoe with a folded sock. Someone without nerve damage would likely notice immediately, but if feeling in your feet has become reduced, you may continue walking without realizing you've been injured. That's one reason foot care is such an important part of diabetes management. Here's something many people don't realize. Nerve damage doesn't always begin with numbness. Sometimes it begins with pain. Some people experience sharp electric-like sensations. Others notice burning feet that become uncomfortable as soon as they lie down to sleep. A few feel extreme sensitivity, where even the weight of a bedsheet against their toes becomes irritating. While these symptoms don't automatically mean diabetic neuropathy, they do deserve a conversation with your healthcare provider, especially if they're new or becoming more frequent. There are also simple habits that may help protect your nerve health over time. Keeping your blood sugar as close as possible to the target range recommended by your healthcare provider is one of the most important steps. Staying physically active supports healthy circulation, while well-fitting shoes reduce the risk of unnoticed injuries. Routine foot exams during medical appointments can also identify problems before they become serious. Many people living with diabetes focus almost entirely on the number they see on their glucose meter. While those numbers matter, they're only part of the picture. Your body is giving you information every single day. The condition of your skin, the feeling in your feet, the speed at which a scrape heals, the way your shoes fit. These everyday observations may seem small, but together they can tell an important story about your overall health. Learning to notice those quiet changes and acting on them early is one of the most powerful ways to protect your mobility, your independence, and your quality of life for years to come. The third warning sign is one that many people notice but rarely connect to diabetes until someone points it out. It's changes in your vision that come and go. Imagine sitting down in your favorite chair to read the morning newspaper or checking a recipe while making breakfast. One day, the words seem perfectly clear. The next day, they look slightly blurry. You clean your glasses, thinking they must be dirty, but the problem doesn't completely disappear. Then, a few hours later, your vision seems normal again. It's confusing, isn't it? Many people assume they simply need a stronger pair of glasses. While eyesight naturally changes as we age, vision that suddenly becomes blurry or seems to fluctuate from day to day deserves attention, especially if you have diabetes. Here's why. Your eyes contain tiny, delicate blood vessels that help nourish the retina, the part of the eye responsible for sending visual information to your brain. Over time, consistently high blood sugar can damage these small vessels. In the early stages, you may not notice anything unusual at all, but as changes progress, blurry vision, difficulty focusing, or seeing dark spots can begin to appear. Another reason your vision may change is that blood sugar itself can temporarily affect the shape of the lens inside your eye. When your glucose level rises or falls significantly, your eyesight may seem sharper one day and blurrier the next. That's one reason eye doctors often recommend waiting until blood sugar is reasonably stable before updating a glasses prescription. Here's something many people don't realize. Diabetic eye disease can develop without causing pain. In fact, you may still be able to read, drive, and watch television while small changes are quietly taking place inside your eyes. That's why regular dilated eye exams are so important. Even if you believe your vision is fine, these exams allow an eye care professional to look directly at the blood vessels inside your eyes and detect problems long before you notice symptoms. Finding changes early often provides more treatment options and can help preserve your vision. A good habit is to pay attention to any new visual changes. Blurry vision that doesn't improve, seeing floating spots, flashes of light, difficulty reading, or areas of missing vision should never be ignored. If these symptoms appear suddenly, especially if they're severe, seek prompt medical attention. Your eyesight supports nearly everything you enjoy: reading to your grandchildren, driving to the grocery store, watching your favorite baseball game, or simply recognizing a familiar face across the room. Protecting it begins with noticing the quiet changes before they become lasting ones. The fourth warning sign is feeling unusually thirsty or needing to urinate much more often than usual. Now, most of us drink a little more water on a hot summer day or after spending time outside. That's completely normal. But if you're constantly reaching for another glass of water, waking up multiple times every night because you have to use the bathroom, or feeling like your mouth is dry no matter how much you drink, your body may be trying to tell you something important. Here's what happens. When blood sugar rises above what your kidneys can comfortably handle, they begin removing the extra sugar through your urine. Sugar pulls water along with it, causing your body to lose more fluid than usual. As a result, you urinate more frequently, and because you're losing so much water, you become thirsty. It's a cycle that can sneak up gradually. Some people don't notice it because the changes happen over weeks or months. They simply start carrying a water bottle everywhere. They avoid long car rides because they know they'll need frequent bathroom stops. They wake up 2, 3, or even 4 times every night, assuming it's just part of getting older. But frequent nighttime urination isn't always just about aging. For someone living with diabetes, it can be a sign that blood sugar isn't as well controlled as it should be. Of course, there are other possible causes too, including certain medications, bladder conditions, enlarged prostate in men, or other health issues. That's why it's important to discuss persistent changes with your healthcare provider rather than guessing the cause yourself. Here's where many people make a mistake. They try to solve the problem by drinking less water. At first, that sounds logical. If you're using the bathroom too often, maybe you should drink less. In reality, becoming dehydrated can make you feel even worse. You may experience headaches, dizziness, fatigue, constipation, and difficulty concentrating. Instead of restricting fluids without guidance, it's much safer to talk with your healthcare provider about what's causing the increased thirst and urination. One practical tip is to notice patterns. Are you thirstier after certain meals? Do you wake up at the same time every night? One practical tip is to notice patterns. Are you thirstier after certain meals? Do you wake up at the same time every night? Have you recently started a new medication? Keeping a brief record of these details can provide valuable information during your next appointment. Another habit that often gets overlooked is monitoring your blood sugar as recommended by your healthcare provider. Numbers can reveal trends that your body is already trying to communicate through symptoms. The encouraging news is that many people feel noticeably better once the underlying cause is identified and addressed. Their energy improves. They sleep through the night more often. They feel less thirsty and more comfortable throughout the day. The important lesson is this: Don't dismiss repeated changes simply because they've become familiar. When symptoms slowly become part of your routine, it's easy to stop noticing them. But your body hasn't stopped speaking. It's simply waiting for you to listen. The more attention you pay to these everyday clues, the better equipped you'll be to recognize when something deserves a closer look. Small observations today can help prevent much larger health challenges tomorrow. The fifth warning sign is one that often develops so gradually that many people don't recognize it until it begins affecting their daily routine. It's constant fatigue that doesn't improve with rest. Everyone has days when they feel tired. Maybe you spent the afternoon working in the yard, chasing after your grandchildren, or running errands across town. That's normal, but this kind of fatigue is different. Imagine waking up after what should have been a full night's sleep. You make your morning coffee, sit down at the kitchen table, and instead of feeling refreshed, you already feel drained. By lunchtime, you're ready for another nap. A short walk around the neighborhood feels harder than it did just a few months ago. Even simple household chores seem to take twice as much effort. Many people assume they're simply getting older. The surprising truth is that poorly controlled diabetes can leave your body struggling to use its main source of energy, glucose. Think of glucose as fuel for your body's engine. Even if there's plenty of fuel available, your cells need insulin to help move that fuel where it's needed. When insulin isn't working effectively, or when your body doesn't produce enough of it, glucose builds up in your bloodstream instead of reaching your cells efficiently. It's a bit like having a full gas tank, but a clogged fuel line. The energy is there, but your body can't use it the way it should. That's why some people with diabetes feel unusually tired even after getting enough sleep. Fatigue can also be made worse by dehydration, poor sleep caused by frequent nighttime urination, certain medications, anemia, heart disease, or other medical conditions. That's why it's important not to assume diabetes is always the only explanation. Persistent fatigue deserves a conversation with your healthcare provider so the underlying cause can be identified. Here's where many people unintentionally make things harder on themselves. Because they feel tired, they become less active. At first, it seems like the right decision. They skip their daily walk. They spend more time sitting in front of the television. They avoid meeting friends because they don't have the energy. Unfortunately, less movement often leads to weaker muscles, reduced stamina, and lower overall fitness. Over time, everyday activities become even more exhausting, creating a cycle that's difficult to break. The encouraging news is that gentle, consistent activity often helps improve energy rather than reduce it. You don't need to run miles or spend hours at a gym. A 15 or 20-minute walk after dinner, light stretching in the morning, gardening, swimming, or even walking through your local shopping mall on a hot or rainy day can help improve circulation, support blood sugar management, and maintain muscle strength. Many people are surprised to discover that moving a little more each day actually helps them feel less tired over time. The sixth warning sign is frequent infections or recurring skin problems. Think about the last time you had a small skin irritation or a mild infection. Normally, with proper care, your body fights it off and healing begins. But if you find yourself dealing with repeated urinary tract infections, recurring yeast infections, gum problems, skin infections, or sores that seem to come back again and again, diabetes could be playing a role. Here's why. Higher blood sugar can make it easier for certain bacteria and fungi to grow. At the same time, diabetes may weaken your body's natural ability to fight infection. That combination can make even relatively minor infections more common or more difficult to clear. Some people notice itchy skin that never seems to improve. Others develop dry, cracked skin on their feet, increasing the risk of cuts and infection. Some experience redness between their toes or recurring skin rashes in warm, moist areas of the body. These aren't symptoms to panic about, but they are symptoms to pay attention to. One often overlooked area is oral health. Bleeding gums, swollen gums, persistent bad breath, or loose teeth may seem like dental issues alone. However, diabetes and gum disease can influence each other. High blood sugar can increase the risk of gum disease, while severe gum disease can make blood sugar more difficult to manage. That's one reason regular dental checkups are an important part of diabetes care. Simple daily habits can also make a meaningful difference. Wash and dry your feet carefully, especially between the toes. Use moisturizer on dry skin, but avoid putting lotion between the toes where excess moisture can encourage infection. Wear clean socks and properly fitting shoes. Brush and floss your teeth every day. Stay hydrated and follow the treatment plan recommended by your healthcare provider for managing blood sugar. These habits may seem ordinary, but together they create a strong foundation for protecting your health. The seventh and final warning sign is one that often surprises people because it doesn't always seem related to diabetes at first. It's chest discomfort, shortness of breath, or unusual pain during physical activity. When most people picture a heart problem, they imagine sudden, crushing chest pain. But for many older adults with diabetes, the warning signs can be much more subtle. You may notice that climbing the stairs leaves you unusually short of breath. Walking the dog around the block suddenly feels much harder than it used to. You feel pressure, tightness, or discomfort in your chest, shoulders, jaw, back, or arms during activity, but it fades when you rest. Some people experience nausea, unusual sweating, dizziness, or overwhelming fatigue instead of severe chest pain. Diabetes significantly increases the risk of heart disease because high blood sugar over time can damage blood vessels throughout the body. Even more surprising, diabetes can sometimes affect the nerves that carry pain signals. As a result, some people experience what's known as a silent heart attack, where the warning signs are much less obvious than expected. That's why it's so important not to ignore new symptoms that occur during physical activity. If you develop sudden chest pain, severe shortness of breath, fainting, or symptoms that suggest a heart attack or stroke, seek emergency medical care immediately. Those situations should never be treated as something to wait and see. For less urgent but persistent symptoms, make an appointment with your healthcare provider as soon as possible. It's always better to have a symptom evaluated and discover it's something minor than to ignore a problem that needed attention. One of the most powerful things you can do for your long-term health is to stop thinking of diabetes as something that only affects blood sugar. Diabetes affects your entire body, your eyes, your nerves, your heart, your kidneys, your feet, your skin, and that's exactly why paying attention to these 7 warning signs matters so much. They're not meant to frighten you, they're meant to remind you that your body often whispers before it shouts. When you learn to recognize those whispers, you give yourself the opportunity to act early, protect your independence, and continue enjoying the everyday moments that make life meaningful. As we come to the end of our conversation, take a moment to think about everything we've covered. None of these 7 warning signs are meant to convince you that something is definitely wrong. Instead, they're reminders that your body is constantly communicating with you. The question is whether you're listening. If you live with diabetes, your health isn't determined by one blood sugar reading or one doctor's appointment. It's shaped by the small decisions you make every single day and by the attention you give to the quiet changes your body is trying to show you. Let's quickly bring those warning signs together. A cut that refuses to heal, numbness or burning in your hands or feet, vision that suddenly becomes blurry or changes from one day to the next, constant thirst and frequent trips to the bathroom, persistent fatigue that doesn't improve with rest, recurring infections or skin problems, and chest discomfort or unusual shortness of breath during everyday activities. Each of these signs has one thing in common. They often begin quietly. That's why they're so easy to ignore. Many people tell themselves, "I'll wait another week." Then another week passes, and another. Before long, months have gone by, and a problem that might have been easier to manage has become much more complicated. Here's the encouraging news. You don't have to be perfect to protect your health. You don't need perfect blood sugar every day. You don't need to eat perfectly every meal, and you certainly don't need to feel guilty about the occasional setback. Managing diabetes is a journey, not a test that you either pass or fail. What matters most is consistency. Small improvements made over time often have a much greater impact than dramatic changes that only last a few days. Think about your daily routine. When you wake up tomorrow morning, take a few extra moments before the day gets busy. Look at your feet. Notice how your body feels. Ask yourself whether your energy is different than usual. Pay attention to your vision while reading the newspaper or checking your phone. Notice whether you're unusually thirsty. These simple observations take less than 2 minutes, but they can provide valuable information about your health. Another habit that's worth developing is preparing for your doctor's appointments. Many people leave an appointment and suddenly remember 3 questions they forgot to ask. Instead, keep a small notebook in your kitchen or beside your favorite chair. Whenever you notice something unusual, write it down. Record when it started, how often it happens, whether anything seems to make it better or worse. Bring that notebook with you. Those details can help your healthcare provider connect the dots far more effectively than trying to remember everything from memory. If you check your blood sugar at home, don't focus only on the numbers. Think about how you feel along with those readings. Did you feel unusually tired? Did your vision become blurry? Were you thirstier than normal? Looking at symptoms and glucose readings together often creates a much clearer picture of what's happening. It's also important to remember that diabetes management isn't something you have to do alone. Your primary care provider, diabetes educator, pharmacist, eye doctor, dentist, podiatrist, and family members can all play important roles in helping you stay healthy. Never hesitate to ask questions. If you don't understand something, ask again. If a medication causes new symptoms, speak up. If you're struggling with meal planning, physical activity, or checking your blood sugar regularly, let your healthcare team know. There are often solutions that people never discover simply because they didn't ask. And don't overlook the basics. Sometimes the most powerful health habits are also the simplest. Drink enough water throughout the day. Choose balanced meals with vegetables, lean protein, whole grains, and healthy fats. Stay as physically active as your healthcare provider recommends. Wear comfortable, well-fitting shoes. Take medications exactly as prescribed. Keep up with eye exams, dental visits, and routine checkups. Protect your sleep. Manage stress in healthy ways. These habits may not seem exciting, but together they build a strong foundation for long-term health. One thing many older adults discover is that healthy aging isn't about avoiding every health challenge. It's about responding wisely when those challenges appear. Your goal isn't perfection, your goal is awareness, because awareness leads to action, and action often leads to better outcomes. Perhaps the most important message of all is this: don't let fear keep you from paying attention. Some people avoid mentioning symptoms because they're afraid of what they might hear, but early action usually creates more choices, not fewer. Whether it's adjusting a medication, improving blood sugar management, treating an infection, or identifying a complication before it becomes serious, recognizing a problem early often gives you the greatest opportunity to protect your health. Your body has carried you through decades of work, family, celebrations, challenges, and countless ordinary days that became precious memories. It deserves your attention, it deserves your care, and it deserves your respect. So the next time your body whispers instead of shouts, don't ignore it. Pause, notice, ask questions, and give yourself the opportunity to act early. Those small moments of awareness may help you continue enjoying morning walks, family dinners, vacations, hobbies, church gatherings, time with your grandchildren, and all the simple pleasures that make life meaningful. If you found today's video helpful, we'd love to hear from you. Share in the comments which of these warning signs surprised you the most, or what healthy habit has made the biggest difference in managing your diabetes. Your experience could encourage someone else to take an important step toward better health. And if you'd like more practical, easy-to-understand health information created especially for adults over 50, be sure to subscribe and join us for future videos. Thank you for spending this time with us today. Take good care of yourself, keep listening to what your body is telling you, and remember, when it comes to diabetes, paying attention to the quiet warning signs today can help protect your health, your independence, and your quality of life for many years to come.